Hello, we'll be doing an oral drug administration for Mr. Harry Wilson today. So first things first, I'm going to pull my MAR out and see that there's 400 milligrams ibuprofen ordered. It's QID 4 times a day for PRN for pain or discomfort. Supplied dose is 200 milligrams per tablet. So I've got desired dose over have on hand times my quantity. It leaves me with 2 tablets to give Mr. Wilson today. So we're going to go to the ward stock and pull out our ibuprofen, and we're going to go through our 3 checks. So taking the medication out of the drawer, I'm going to check that it's ibuprofen, 200 milligrams, and the expiry is 12/20/35. That's my first check done. Second check is to pour the medication. So we're going to go 200 milligrams of ibuprofen, expires at 12/20/35. Taking care not to touch the medication. 1 and 2. We're going to leave that out and complete our 7 rights. So our first right is that's right patient. So this is, according to the MAR, Mr. Harry Wilson. When we get to bedside, we'll do 2 patient identifiers for Mr. Harry Wilson. Next is the right drug. So this is ibuprofen, 400 milligrams. We've supplied it in ibuprofen 200 milligrams, so it's 2 tablets. Dosage, I just said that it's 400 milligrams, so it's going to be 2 200 milligram tablets. Right route, this is a PO medication according to the MAR. Tablets are going to be PO. Time, this is a PRN medication. I'm making sure that we haven't given Mr. Harry Wilson more than 4 today, and we haven't given it more than 4 times. Right reason, ibuprofen is a non-steroidal anti-inflammatory drug given as an analgesic for discomfort, and that fits the bill for Mr. Harry Wilson's MAR here. And documentation, I'm going to provide the right documentation by signing my MAR once I've given the medication. So now we're going to take our medication and our water to the bedside. Okay, we're going to bring our MAR too as well. I'm just going to bring this table over here so I have a nice stable working platform. Good morning, Mr. Wilson. My name is Ben. I'm a nursing student. I'm just going to be giving you your ibuprofen today. It's 400 milligrams, 2 tablets. I'm just going to bring the bed up to a safe working height. And I'm also just going to sit you up. Okay, Mr. Wilson? When giving PO medication, it's important to sit the patient up. It decreases any risk of aspiration or choking giving this medication. So what we're going to do here is we're going to confirm that this is Mr. Harry Wilson with our MAR. So we've got Harry Wilson here. And Mr. Wilson, could you confirm your date of birth?
September 22nd, 1946.
Perfect. Thank you, Mr. Wilson. And could you spell your last name?
Wilson.
Perfect. And we're just going to check that you have no allergies here, Mr. Wilson, on your allergy band. Perfect. No allergies. Okay, Mr. Wilson, how would you like to take this medication? 1 at a time or 2 at a time?
I can take them both.
Okay, sounds good. So what I'm going to do is recruit both hands here. I'm going to put this medication in your hand. I guess it's going to be hard to do. Right here. This is a real person. This will be a lot easier. He's going to pop that into his mouth. And here's your water in the other hand. He's going to take a sip of water. I'm going to watch that he's effectively taking his medication. Awesome. And could you just open your mouth for me and lift your tongue? Awesome. So he's taking the medication. I don't see it in his oropharynx anymore. And it's important to leave the bed up in the upright position for about 30 minutes after we've given it. Mr. Wilson, I'll check back on you in a little bit to see how you're doing. Okay, thank you. Take care.